Why do caregivers feel guilty for resenting loved ones? Imagine caring for someone you love deeply and feeling overwhelmed by it all. It might seem strange or even wrong to admit that sometimes you feel irritated or resentful. But these feelings are more common than many realize. Caregiving involves a complex mix of emotions because it is rooted in love, duty, and responsibility. When the demands become too much, feelings like frustration or resentment can naturally emerge. Caregiving often requires managing medical appointments, medication schedules, personal care, and emotional support. These responsibilities can take over your life, leaving little time for your own needs or interests. When caregivers feel this way, they might think they are failing or that they are bad people for feeling anything but love and compassion. Society often promotes the idea that caregiving is a noble act that should be done without complaint, which can make admitting negative feelings feel shameful. Many caregivers also experience guilt because they believe they should always be patient and selfless. If they get angry or resentful, they worry it means they do not love their loved ones enough or are not fulfilling their duties properly. Family dynamics can add to these feelings. For example, if some family members are less involved, caregivers might feel isolated or unfairly burdened, which can increase resentment and guilt at the same time. Unrealistic expectations also play a role. Caregivers often feel they must do everything perfectly or handle everything alone. When they fall short or feel exhausted, guilt can set in. Caregiving involves many losses, like giving up personal freedom, career opportunities, or future plans. These losses can cause feelings of grief and resentment, but caregivers might also feel guilty for having these negative emotions about someone they love. Emotional exhaustion is another factor. Chronic stress and fatigue can make patients thin and irritability high. Caregivers might direct these feelings inward as guilt or outward as resentment. For those with post-traumatic stress disorder, these feelings can be even more intense. PTSD can increase emotional sensitivity and stress responses, making resentment feel stronger and guilt harder to manage. Intrusive memories or hypervigilance may also add to the emotional burden, complicating caregiving even further. To help manage these feelings, it's important to recognize that resentment is a normal response to a tough situation. Seeking support from friends, family, or mental health professionals can provide relief and reduce feelings of isolation. Setting realistic goals and accepting help can lessen the caregiving load. Taking time for self-care, such as engaging in relaxing activities or therapy, can restore emotional balance. Practicing mindfulness or stress reduction techniques can also be very helpful. Remember, feeling guilty about resentment does not mean you are failing. It reflects the reality of caring for someone under difficult circumstances. Understanding and accepting these feelings can help you cope better and find healthier ways to manage stress. This balanced perspective benefits both your well-being and the quality of care you give. Always consider consulting healthcare professionals for personalized support, especially if feelings of guilt or resentment become overwhelming. Every caregiver's experience is unique, and seeking help is a sign of strength and dedication to both your health and your loved ones.